Hello, good afternoon. It's Dr. Adi again. I hope you've been well. Now, today we're going to discuss male health, and we're going to discuss what we call 2-week referrals, urgent referrals. That means if you notice these symptoms, we'd like to see you as soon as possible so we can refer. And this is when you see blood in your urine over the age of 45. That's important that we see you. We'll run some basic tests first to rule out other things, but the likelihood is you'll be referred on the same day. The history is very important, so we'd like to know what medication you're on, whether this could have caused it, like blood thinners, or whether you have an underlying medical problems that could predispose you to bleeding in the urine. Now, the next thing also is when you're getting water infections. Now, water infections are not very common in men, so 9 out of 10 cases would be women. If you notice that you've got symptoms of water infections, i.e. going to the toilet more often and it's painful and it's offensive, we still like to see. We take it a lot more serious in that we want to know why it happened in the first place. Is there an underlying reason? Over the age of 60, if this occurs, you're going to be referred straight away. If you're 45, we'd like to treat. We'll treat in both cases anyway, and then we'll repeat the test. If on repeat of the test, you've still got persistent signs in your urine, you will be referred as well. Now, that's to do with the bladder. The next thing which you're well aware of is the prostate. Prostate symptoms are quite common, you know them, and they do include going to the toilet more often, waking up at night, you have that urge to get up and wee, and you go there and you're only passing a small amount, and even when you finish, you feel as if there's lots of water left behind. Now, in most cases, this is just benign, but we still like to know so that we can check you to be on the safe side. In some cases, there will be blood in urine, and that can occur even in benign situations. But when we like to do what we call a digital examination, which is a prostate examination, and that would determine whether we do an urgent referral or not, because it feels slightly different when it's benign and when it's malignant. Okay, so that is one. Now, the next thing I want to discuss today is the bone pains that you can get in the presence of prostate problems. Now, if you notice you're getting bone pains, low back pain, and you've got prostate symptoms or unexplained weight loss, I need to see you as soon as possible. Thank you very much. Have a good day.